Socioeconomic and psychological tracks. Hujun, maybe the first speakers could come and just sit up here. That would be easiest. I know we've got one recorded speaker, and I know Hujun is going to introduce our first speaker, who is Hongjo Singh. Choi, is that how to pronounce it? Yeah.
Okay, good morning, everyone. I'm Hojun from South Korea. I'm going to invite for the first talk for our social, economic, and psychological consequences of TB by Professor Hongjo Choi from South Korea. He's from Korea University. He's a very close colleague of mine. We, for the past 6 years, with the government funding and a bunch of different Korean CDC funding, we have been integrating our Korean TB notification data for past 10, 12 years with the national health insurance claims data and the national mortality statistics data. So we iteratively worked to clean up our data, and towards the end of this year, we will make this data public for people to use. So Hongjo will be discussing the potential opportunities to study post-TB sequelae and syndromes using our data. Hopefully there are other data sources available, but and I would like to have this opportunity to have Hongjo and come and speak to you about the potential opportunity. Hongjo?
Can I see to my...
Okay, thank you for introducing me. I'm Hongjo Choi from Korea University. It's my honor to be here. It's a really good opportunity to share our experience in terms of the post-TB area. I'd like to share the South Korean journey to meet the post-TB researcher here. So I'd like to talk about the big data study for post-TB studies using the administrative data focused. Usually we used the health insurance claim data and the death cause of statistics, including the national TB surveillance data. So this is the content. Actually, we started this kind of effort in 2019. So this is the 6 years journey. We construct the Korean TB post cohort. And then I'd like to introduce the briefly, and also I talk about the national TB. Our study focused on the impact evaluation of national TB policy, and thirdly, I'd like to talk about our effort to do much more than the end of therapy of tuberculosis. So, as you well know, when I was a student in medical school. In terms of tuberculosis, I also learned about the smear-positive tuberculosis, how to diagnose this and how to treat them. And also, in terms of the prevention of tuberculosis, we only focused on the BCD. However, the focus usually shifts in the area of policy and research as well. As you know, there are at that time there's no knowledge about no interest about the asymptomatic TB, subclinical TB, even in the latent TB as well. The interest was moved to write this kind of way. So finally, I thinking about the smear-negative TB and outcome. However, some time later, there are several kinds of determinants, not just focused on social determinants, the other kinds of biological determinants as well. And also, latent TB infection is a main interest of policy and the studies. Here, there are so many kinds of bugs generated again. Currently, we are not talk about the latent TB and active TB as a dichotomous approach. Rather, we are thinking about the spectrum between latent TB and active tuberculosis, including incipient TB and subclinical TB as well. And also, we are thinking about the next of the treatment completion. so up to the end of life. So we are thinking about a lot of kinds of commodity in this symposium. Most of those concerns are the main topic of in this symposium, and also we are thinking about the other kinds of consequences as well. So, in terms of this kind of perspective, we started to develop a new cohort, including the national TB surveillance data here, and also national health insurance claim data. So we, at the first phase of our surveillance, TB surveillance system, we only focused on the notification. At that time, we are not very concerned about how to measure the diagnostic result and treatment outcome, something like that. So it's quite difficult to keep the quality of data from the national TB surveillance database. However, in the quite 10 years effort from the Korean CDC, we assured appropriate quality of data within the national TB surveillance system. So we started to combine those data with the health insurance claim database. So this is the brief structure of our database, and also we published the cohort profile in 2022. The effort was started from 2019. At that time, we identified firstly, we can raise the cause of death other than tuberculosis, and also we identified the cancer and other kinds of diseases are very highly ranked as a cause of death after TB treatment completion. So with this database, we started to do something. First of all, we are talking about, I want to talk about the impact evaluation of national TB policy. So there are several kinds of policy were evaluated with this database. First of all, nationwide PPM, public-private mix launched in 2009 in South Korea, and also extended at every place in South Korea in 2011. We tried to identify the real impact of nationwide public-private mix. And also we identified a PPM improved treatment success rate as the main aim of the policy. However, we also identified some increased proportion of lost follow-up among transport people. So our main policy focused on the treatment and management of patients within private hospital. At that time, the policy haven't considered about what happened the people, TB patients between hospital. So we identified this kind of gap and then raised the gap as the priority of the next policy development. And also, the Korean government launches the out-of-pocket exemption policy in 2016. And also, we identified this policy modestly reduced mortality. However, we identified there's no impact on the treatment success rate. And the same year, the Korean government started the pre-entry screening for all migrants who are staying more than 90 days in South Korea. And then we identified this kind of pre-entry screening policy improved the treatment success rate. And also we identified some gap. Those policies did not affect the mortality. This is the initial phase of achievement with this kind of database. And also, our collaborator, some of our collaborators working in the hospital, and their interest is focused on the clinical side. So we also conducted clinical perspective studies. First of all, I'd like to show among the fluoroquinolone-resistant MDR-TB patients, we have all kinds of 5 minutes. Okay, so. Beta-catenin measures improve treatment success rate in the real-world data. However, we identified there's no impact on mortality. And also, the fixed dose combination improves treatment success rate, but did not reduce the recurrence rate compared to the single drug formulation. And other kinds of results can be generated with the TB post-TB cohort. And this is the other dimension about the multi-morbidity. We also try to identify what kind of comorbidity have among the TB patients, and also we identified the prevalence of congestive heart failure, dementia, increased more in women than in men with TB, and also we identified the prevalence and mortality among TB and diabetes. And finally, we identified the metformin using effect among the TB and DB patients, like this kind of way, and beyond TB. So as I mentioned before, we can construct this kind of cohort. It's very useful to understand what happened of the TB patient before TB diagnosis, after TB diagnosis as well. So we try to identify this kind of thing. First of all, we try to identify the recurrent rate and association with diabetes among TB survivors. A similar mortality, we identify similar mortality after lost follow-up and not evaluated among MDR RRTB patients. However, the not evaluated had a better treatment success rate if they retreated. Finally, we identified the retreatment after lost follow-up in RR-MDR TB patients reduced all-cause mortality. And I'd like to share the socioeconomic consequences before and after TB. Maybe the previous this symposium, Dr. Thorne already introduced the first study. Medical costs were higher in TB patients compared to the non-TB. Both before and after, the gap is increased compared to the previous gap, before TB. And also, I identified the income inequality worsened more in TB patients than in non-TB individual using this kind of database. So I'd like to share the strengths of big data. We can use the entire population in South Korea. It might be useful to identify other kinds of hypotheses. And also, our data has a very rich and repeatedly measured information, such as TB-specific data, social demographic information, we can track the healthcare utilization, including cost and medicine, and also we can collect data by annual health checkup metrics as well. Those kind of information may offer the proof of concept for the future basic science and prospective study as well. This is our future plan, maybe the last slide. So currently we are constructing biosync network in South Korea to identify this kind of mechanism. So maybe you know, when we adopt the syndemic theory, according to the syndemic theory, there are three different factors. Maybe there are three different mechanisms to explain those kind of syndemic theory. We also apply this kind of theory within the TB research. Okay, our collaborator, thank you. That's it.
Thank you, Professor Choi or Hongjo. It's hard to put in